Hi, I'm Dr. Sulata Shenoy, Psychologist and Director, Turning Point, Center for Psychological Assessments, Therapies and Counselling, Jayanagar, Bengaluru. So, due to the pandemic, we have seen a rise in cases of anxiety, depression, domestic violence, aggression, rage episodes, complete breakdowns, and surfacing of subliminal psychopathological conditions. So, a lot of people are actually in dire need of mental health services, and they do not know where or how to access these services because they have never done it earlier. So, what is going to be the new norm is that you must reach out to professionals. You must make the attempt to contact people who are there to help you. The sad or unfortunate part is that we have never been taught to reach out to a mental health professional unless it is in very dire circumstances, and you do it very surreptitiously so that people don't think that you are mad or you are weak or you are somewhat lesser of a human being than others. Reaching out to mental health professionals should be seen as a very normal, a very natural part of development or growing, because all of us need some kind of assistance in certain times. So, it's just like how you would approach a doctor when you are unable to handle maybe a physical condition. In the same way, we should be teaching our young people also that they should reach out to mental health professionals when they cannot handle things on their own. When things get too stressful, too tough, please reach out and please help others reach out also to mental health professionals. And nowadays it is not difficult. The government has announced several helplines, several numbers have been given, several centers have been designated for COVID mental health counselling. There are many NGOs who are doing this good work. There are many private psychologists, psychiatrists, counselors who are constantly available, and they are also able to do it online. So, it's not that you have to step out of your home or put yourself at risk to avail of mental health services. All these services can be availed of from home itself, and in case you need to do any kind of investigation or tests before you take up a psychiatric, or that is also available to you, but provided you reach out. So, it's not that there is a dearth of mental health professional services, it's just that people have that hesitation to reach out. So, that is something that you need to be open to and take care of. The second is about telemedicine. Now, with the lockdown, a lot of doctors have been practicing consultations over phone, and in fact, even now they are encouraged to ask the patient what the symptoms are before they invite the patient to the clinic. So, telemedicine I think is having a huge scope nowadays, and maybe it is never going to be a substitute for a real visit to a doctor, because that comfort you get when seeing the doctor and the doctor's comfort in diagnosing a live patient cannot be substituted on screen. But still, a good number of cases and in a good number of people, telemedicine can work wonderfully. So, I would urge everybody that they need to take up to this, whether they are doctors, mental health professionals or patients. You need to embrace this possibility that technology has offered us without deeming it as to be the one and only solution for your problems. So, telemedicine does have a major part to play, as much as a visit to a psychologist or a doctor or a mental health professional or any other professional services. But do make use of it because it has tremendous benefits.